The pancreas is one of the various hormones-producing glands in the body. It is an elongated organ in the abdomen located in space behind the abdominal cavity. It lies beneath the stomach and is connected to the small intestine at the duodenum. The pancreas is often described as having three regions: the pancreatic head, the body of the pancreas, and the tail of the pancreas. The pancreas performs two main functions: to produce pancreatic endocrine hormones and to produce pancreatic digestive enzymes. The hormone function of the pancreas produces insulin, somatostatin, gastrin, and glucagon, which help regulate many aspects of our metabolism. They also play an important role in maintaining sugar and salt balances in our bodies, and therefore any problem in the production or regulation of these hormones will manifest itself with problems with blood sugar and fluid-salt imbalances. The digestive portion of the pancreas makes up more than 90% of its total cell mass. The digestive pancreas, or exocrine, is responsible for making digestive enzymes which are secreted into the intestines to help digest the food we eat. These enzymes digest proteins, fats, and carbohydrates into much smaller molecules so our intestines can absorb them. Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Cancer can spread throughout your body. Being diagnosed with cancer can be frightening, but understanding what's going on inside your body can help you feel more in control of your disease. Normal, healthy cells in your body grow in a very orderly and well-controlled way, living for a set period of time and then dying on schedule. When a normal cell dies, your body replaces it with another normal cell. Cancer begins with damage in your DNA. Your DNA is like a set of instructions for your cells, telling them how to grow and divide. Normal cells often develop mutations in their DNA, but they have the ability to repair most of these mutations. Or, if they can't make the repairs, the cells often die. However, certain mutations aren't repaired, causing the cells to grow and become cancerous. Cancer cells grow in an uncontrolled manner. They forget to die, and therefore the diseased cells accumulate. One malignant cell becomes 2, 2 becomes 4, 4 become 8, and so on until a mass of cells, a tumor, is created. Tumors remain small until they are able to attract their own blood supply, which allows them to obtain the oxygen and nutrients they need to grow larger. Scientists believe you need a number of changes within your cells in order to develop cancer, including an initiator to cause a genetic mutation. Sometimes you're born with this initial genetic mutation. Other times, a genetic mutation is caused by forces within your body, such as hormones, viruses, and chronic inflammation. Genetic mutations can also be caused by forces outside of your body, such as ultraviolet light from the sun, or cancer-causing chemicals, carcinogens, in your environment. A promoter to cause rapid cell growth. Promoters take advantage of genetic mutations created by initiators. Promoters cause cells to divide rapidly. This could lead to a tumor. Promoters could be inherited, could come from inside your body, or could come from outside of your body. A progressor to cause cancer to become aggressive and spread. Without a progressor, a tumor may remain benign and localized. Progressors make cancers more aggressive and more likely to spread. Like initiators and promoters, progressors could be inherited, or they could come from environmental sources. Your genetic makeup, forces within your body, your lifestyle choices, and your environment can all set the stage for cancer or help complete the process once it's started. For instance, if you inherited a genetic mutation that predisposes you to cancer, you may be more likely than other people to develop cancer when exposed to a certain cancer-causing substance, such as cigarettes, UV radiation, or working with chemicals. The genetic mutation begins the cancer process, and the cancer-causing substances could play a role in further cancer development. Pancreatic cancer is a malignant tumor within the pancreatic gland. About 95% of pancreatic tumors are adenocarcinomas. The remaining 5% are pancreatic endocrine tumors. Diagnosis of pancreatic cancer is difficult because the symptoms are so nonspecific and varied. Common symptoms include abdominal pain, loss of appetite, significant weight loss, and painless jaundice. All of these symptoms can be blamed on other causes. Therefore, diagnosis of pancreatic cancer is often late stage in its development. Jaundice occurs when the tumor grows and pressure obstructs the common bile duct. Tumors of the head of the pancreas will more easily give rise to such symptoms. Risk factors for pancreatic cancer include age, male gender, African ethnicity, smoking, diets high in meat, obesity, diabetes, chronic pancreatitis has been linked, occupational exposure to certain pesticides, dyes, and chemicals related to gasoline, family history, Helicobacter pylori infection. Courvoisier's law defines the presence of jaundice and a painlessly distended gallbladder as strongly indicative of pancreatic cancer, and may be used to distinguish pancreatic cancer from gallstones. Pancreatic cancer is usually discovered during the course of the evaluation of aforementioned symptom. Liver function tests may show a combination of results indicative of bile duct obstruction, raised bilirubin and alkaline phosphate levels. CA 19.9, carbohydrate antigen 19.9, is a tumor marker that is frequently elevated in pancreatic cancer. Imaging studies such as ultrasound or abdominal CT may be used to identify tumors. Endoscopic ultrasound, EUS, is another procedure that can help visualize the tumor and obtain tissue to establish the diagnosis. Treatment of pancreatic cancer depends on the stage of the cancer. Surgery, postoperative chemotherapy, and/or radiation may also be offered. Fluorouracil, gemcitabine, and erlotinib are the chemotherapeutic drug agents of choice. Recent advances have made resection of tumors that were previously unresectable due to blood vessel involvement possible. The Whipple procedure is the most common surgical treatment for cancers involving the head of the pancreas. Pancreatic duodenectomy is the operation of choice for the management of tumors of the head of the pancreas. The basic concept behind this procedure is that the head of the pancreas and the duodenum share the same arterial blood supply, so that both organs must be removed. To remove the head of the pancreas would compromise blood flow to the duodenum. It consists of removal of the distal half of the stomach, the gallbladder, the distal portion of the common bile duct, the head of the pancreas, duodenum, proximal jejunum, and regional lymph nodes. Reconstruction consists of attaching the pancreas to the jejunum, attaching the common bile duct to the jejunum to allow digestive juices and bile to flow into the gastrointestinal tract, and attaching the stomach to the jejunum to allow food to pass through. Prevention of pancreatic cancer consists of avoiding risk factors when possible. Cigarette smoking is considered to be the most significant and avoidable risk factor for pancreatic cancer. Maintaining a healthy weight and exercising may be helpful. Additionally, increasing consumption of fruits, vegetables, and whole grains, while decreasing red meat intake is recommended.